Growing up, he made it very clear that orthopedic surgery was more than just a job, but it was a passion.
He embodies the spirit of HSS.
I think absolutely he is an artist.
He was just a really terrific, incredible dad, and also happened to be this incredible surgeon.
When I went to medical school, orthopedics was something I didn't even know what it was. And I rotated through the different specialties, and then I rotated through orthopedic surgery. And I got to see patients who would come in a wheelchair, and then a week later, were going home walking with a cane. And this was a revelation.
Tom was one of our brightest young residents. You could see that he had a great potential.
It was a focused specialty hospital. I was immediately attracted to that, and I just felt completely at home here.
One of Tom's great virtues is his equanimitas.
Equanimitas. And that's one of his themes in life, which is being very even-tempered and not being affected by external pressures.
Which is a crucial virtue in a physician, and Tom has followed equanimitas to the highest standard.
He's been a father figure, not just to me, but to countless residents, fellows who've turned to him for guidance.
To be mentored by Dr. Sculco is really an incredible experience. Being in the operating room with Tom, it's just one of artistry. You feel like you're doing it even though he's doing it, and the result is incredible.
He believes strongly that residents are the future. Always been very generous with his time and really support them through their careers.
Being a great educator, it is a selfless act. It epitomizes Tom Sculco.
And along with Matthias Bostrom, he also propelled our residency program to be ranked #1.
Tom and his wife Cynthia really built up the Autumn Benefit, which supports education.
That's been a real passion for both of us.
My dad obviously is super dedicated to his patients and to HSS, but he was around and supportive.
He cut his OR schedule in half when I was in high school and made every high school basketball game I ever played.
We had family dinner every night, even if it was at 8:30.
If Tom could come home, he'd have dinner, and then he'd go back to the hospital. If it's going to be later, we'd have early dinner, and then sit down and do it again.
My wife is a nurse, so nursing has a very special part of my heart.
He has always been supportive of scholarships, awards, tuition reimbursement programs.
The patient's experience in recovery would not be what it is without nursing and physical therapy.
As a doctor, I think he keeps a lot of emotions in check, but growing up and going to the opera, you look over at him and he is in tears.
My father was a musician. Opera has all the emotions, very passionate, very moving, very beautiful, very creative. And we play music in the operating room. So my anesthesiologists have grown to love opera.
The emotion of music and just his emotions in general allow him to connect with so many people.
There's a light that follows him. That beautiful hair, those beautiful eyes, that smile. He gives you a lot of confidence.
He was so kind, and the way he spoke to us with such respect and softness. And the minute he put his initial on the limb, it was like no fear.
When I walked into his office, there was a bond. And to this day, that bond is still there.
It's hard to be surgeon-in-chief. You have to be a role model. You need to love what you do and be inspired by what we do. And Tom embodies that.
He started the HSS Journal. He had a commitment to research and knew that research had to be one of the pillars of what we did here.
And he really fostered relationships with famous orthopedic specialty hospitals throughout the world.
For the first time, CEOs and surgeons and scientists met together to have the best solution in the patient care. This was the beauty of the ISOC.
He was surgeon-in-chief for 11 years. He always felt that HSS was the #1 orthopedic hospital.
And it was during his tenure that HSS became consistently #1 in orthopedics.
His insatiable appetite for the organization to move forward is unabated.
Dr. Sculco is always trying to achieve the beauty in life.
He'll do his best to speak Greek, Italian, French, Chinese. I mean, he tries to put himself into other people's shoes and engage with them in a way that I think is about being someone who enjoys life.
He loves his patients, he loves his colleagues, he loves HSS. That's just a part of who he is.
It's very special to really have that kind of feeling that you've really been involved so long with some very, very special people.
It's still a very special experience for me. HSS has really provided me the opportunity to do all those things that I've wanted to do.